For millions of Americans today, the cost of health care continues to be one of, if not the major concern as we look to reduce costs in a recovering economy. And for many of us, employee-sponsored health insurance can be a cost-saving benefit. But with the rise in health care costs, Wake County government has taken a big step in helping to promote healthy living among its employees and has improved the health of employees while reducing health care costs even further. From sponsoring employee 5K events, which I have never taken a part of, to starting a diabetes prevention program, Wake County leaders hope it will benefit both the Wake County employees and citizens by reducing what's spent in the doctor's office or in a hospital. With us to talk about this important initiative is Caroline Hipple, Benefits Specialist and Wellness Coordinator with Wake County Human Resources. Thank you so much for being here.
Thank you.
Caroline, can you first tell us how this initiative all began?
Well, here at Wake County, our wellness program officially started a little over 6 years ago, which was the same time that healthcare costs throughout the country were really starting to skyrocket, and employers were having to take a step back and think, what can we do to help manage these costs while still maintaining coverage and affordability for employees? So here at Wake County, we really wanted to shift how healthcare was viewed. We wanted to change it from something that happened to you to something that you were a part of. So that's where the wellness program came in. We wanted to give employees the tools to easily make improvements to their health, and by improving their health, hopefully avoid the debilitating and often very costly diseases and illnesses that can come along with health issues.
What type of feedback did you get from Wake employees about this?
Employees have really embraced this as another benefit to working at Wake County. I think it's one thing to try to improve your health on your own. It's another thing to do it with the support and opportunities that our program can provide. We put out an employee wellness survey once a year to kind of gauge where employees are at, what they're interested in, where they want to go. And you know, everyone wants to be healthier in some small way at least. So sometimes it's hardest just to get started or to know where to start, and that's really where we come in. We hear all sorts of success stories from employees who have reduced their diabetes risk or lowered their blood pressure, or who just feel better after attending one of our programs. So that's really what we want to hear and what we want to get out of this.
And could you share with the viewers some of the programs offered to employees?
We offer a wide range of opportunities. We do everything from lunch and learns and seminars on a variety of wellness topics. We host on-site fitness classes for employees. One of our flagship offerings is our Living Well at Work Diabetes Management Program, which places employees with diabetes into support groups that are led by certified diabetes educators and coaches who help them better understand and know how to manage their diabetes, which is such an epidemic right now throughout the country. And that program has been hugely beneficial, both for the individuals as well as it's resulted in great cost savings on our diabetes-related health claims. We have the Know Your Numbers program, which encourages employees to get their preventive health screenings, to identify their health risk factors, hopefully before those turn into chronic and major issues. One of the more fun activities we do, as you mentioned, is the Wake County Employee 5K, which is a lot of fun. We have a lot of first-timers come out to that.
One day, one day.
That's a very motivational event because we have many people who train for the first time, have never run a step before in their lives and come out. So that's a very popular activity. We also do challenges throughout the year. We've got a walking challenge going on right now where employees are wearing their pedometers to track their steps. And the goal is to get 10,000 steps a day, and people take this very seriously. People tell me stories about how they purposely take the stairs instead of the elevators, or park far away in the parking deck, or do a lap around the bed right before bedtime just to try to get those steps, which I think that's really the focus of our program. When wellness becomes something you want to do, that's our goal.
Yeah, I can say firsthand knowledge of seeing Caroline and another co-worker going up the stairs, 14 flights almost?
That's right, yes.
14 flights, and all I do is wave at you and say, I'm taking the elevator. But of course, you know, I'm joking about that, but it's that type of participation that makes or breaks any kind of program, any initiative. But what makes this wellness program successful?
Well, we already have a great culture of wellness here at Wake County. We've had excellent support from our Board of Commissioners and our senior management. They believe so much in this program that last year we were able to open an employee health center, which allows employees to have even easier access to health care at work. So it's accessible and affordable. That was a huge vote of confidence, and we would certainly need to continue that level of support. And on our side, on the program side, we need to ensure that our offerings are what the employees need and want based on the surveys, based on our medical claims, and adapt those as we go along, as the population changes, as the organization changes. We always want to have something fun and interesting because everyone has heard, eat your vegetables, exercise more. So we need to be sure to package those ideas in new and different and exciting ways. Because each individual has something different that will click with them, where they say, okay, this I can do, this I understand. So that's how we can keep up employee interest and make the program successful.
And of course, as citizens listen to you really talk about this program and what it means to the employees, there is a savings, though, that's passed on to taxpayers with the reduced medical costs, correct?
Absolutely, absolutely. The long-term effects are a huge benefit because taxpayers do subsidize part of our employee health insurance. So if we can help employees lose weight, eat better, reduce stress, stop smoking, then that will help lower the cost that comes along with caring for the problems that are part of unhealthy behaviors. So that's dollars saved rather than using them on health insurance claims, prescription drug claims. And I think a smaller but still very direct benefit to the citizens is that Wake County employees are citizens of Wake County. They have kids and friends and family that they go home to each night. So if there's one employee that can make a healthy lifestyle change, then that'll affect those that they are closest to. So if we have an employee who comes to one of our nutrition seminars and learns a new recipe and takes that home and fixes something healthy for their family that their family enjoys, then that's an immediate difference, and small changes can turn into lifelong habits, and that's really what we hope will make Wake County a healthier and happier community as a whole.
Okay, Caroline Hipple with Wake County Human Resources. Thank you so much for being here.
Thank you, Eric.